Good morning or good afternoon to you. My name is Gasia, Mikaelian, and I'm joining you now for our daily live stream and to bring you the newest information as it relates to the global coronavirus situation, what's happening in your state and in your community. We're live streaming this information for you every day starting at 1 o'clock Eastern, 10 a.m. Pacific time. That's when we're joining you here to get you the newest information. Just a few minutes ago, the World Health Organization declared that the coronavirus outbreak has now reached pandemic status. If we could, I'd like to play for you more of what the WHO General Director had to say in announcing the fact that the coronavirus is now a global pandemic.
In the past 2 weeks, the number of cases of COVID-19 outside China has increased 13-fold, and the number of affected countries has tripled. There are now more than 118,000 cases in 114 countries, and 4,291 people have lost their lives. Thousands more are fighting for their lives in hospitals. In the days and weeks ahead, we expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher. WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. Describing the situation as a pandemic does not change WHO's assessment of the threat posed by the virus. It doesn't change what WHO is doing, and it doesn't change what countries should do.
Listening live here as just minutes ago, the head of the WHO, the World Health Organization, announced the coronavirus outbreak has now reached pandemic levels worldwide. It's important to stress here there is a difference, but we shouldn't be alarmed. An epidemic is an event in which a disease is actively spreading. In contrast, the word pandemic relates to the geographic spread. Pandemic is typically used to talk about diseases that affect an entire country or the entire world. Certainly, we are seeing hotspots, if you will, pop up. But again, the WHO has made a shift in its terminology here when it comes to coronavirus and is now calling it a pandemic. That having been said, we'd like to start with the latest numbers for you here to help you get a good grip on what's happening in your state as we look nationwide. Washington State still has the most in the country with 267 cases confirmed in Washington State. New York is next with 173 cases. California very close to that, in fact, with a few more, specifically 181 cases in the state of California. Then we see a pretty good drop here for our next state. Massachusetts comes in next with 92 confirmed cases. Florida is next, but again, these are just the confirmed cases. Many people are wondering and saying that likely there are more cases out there that we don't know about. We just popped the numbers back up for you on the bottom left of your screen, and let's take the big picture now as we talk about what's happening to the markets. I know the Dow was down from the very start this morning. We saw another steep drop on the stock markets, and there is no end in sight due to the turbulence from the corona crisis, which is now being called a pandemic. Take a look at your screen. The Dow Jones is down by more than 5 full percentage points, losing about 1,260 points right now. The Nasdaq and the S&P aren't doing quite as bad, but still they are very deeply in the red. S&P is down by 4 2/3%. The Nasdaq is down by almost 4.5%. It's interesting. You can see with me that stocks were down sharply at the open, and they appear to make a bit of a recovery, perhaps in the last hour or so. But then just in the past few minutes, as soon as we heard from the WHO, that the coronavirus crisis is now a pandemic. Stocks are sinking even lower. Many investors looking for some certainty that is nowhere in sight. Also hoping to learn more from the federal government as to what measures will be put in place to help lift the national economy. We've also been focusing very heavily, and let's do that again, on what's happening in the Port of Oakland. That's where a cruise ship carrying some 3,500 people, the Grand Princess, docked at the Port of Oakland almost exactly 2 days ago. Here we are, it's Wednesday, and there are passengers who are still on board the ship and haven't been able to come off just yet. Let's bring in KTVU Fox 2's Sarah Zendenam. She's live there at the Port of Oakland. Bring us the situation with those people still on board behind you, Sarah.
Hi, Gasia, that's right. People are still on board. About 1,000 passengers still on board on this third day of disembarkation. But the good news is that there's a chance that all of those passengers will be taken off the ship today. If this does not wrap up today, it will go into tomorrow. But Cal OES tells us their goal has always been to wrap this up on day 3. We have seen a couple of big charter buses make their way over here. You can see we counted about 3 that rolled up here at about 8:30 this morning. Those, of course, are the buses that will take those passengers to their quarantine locations, which could be in California, could be in Texas, Georgia. Those are just some of the spots, of course, for these quarantine people. I'll let Keith kind of pan around and see if we can zoom in and see any of the passengers that are on their balconies. Of course, this is a much different look than what we saw just a couple of days ago when these balconies were completely packed full of passengers. Now there are only a couple of people standing outside. We saw some people walking on the top deck. So like I mentioned, about 1,000 passengers left on this ship, about 1,100 crew members. Now we did get some new numbers from Cal OES about the people who disembarked yesterday. There were about 1,000 people that disembarked yesterday. 600 of them were transferred to Travis Air Force Base in Fairfield. About 120 took a chartered flight to Dobbins Air Reserve Base in Georgia. About 100 took a chartered flight to Lackland Air Force Base in Texas. 130 took a chartered flight to the UK. And 3 people were taken by ambulance to hospitals for non-coronavirus related issues. Now, Miramar Marine Corps Air Station in San Diego is also a quarantine location, but that was not where any of the people went to yesterday. There are also 24 people staying at Asilomar State Beach in Pacific Grove. They were showing mild symptoms, so they can't go to Travis Air Force Base, which is in the Bay Area, Fairfield, California. And like I mentioned, about 1,400 passengers have been taken off this ship between Monday and Tuesday. So, of course, on Monday, there were only about 400 people that were taken off the ship. It was a much slower process. That was day 1 of this disembarkation. And they were really making people with medical issues a priority, people that needed assistance in wheelchairs and walkers to make it off the ship. So Monday, much slower process. Things really ramped up yesterday, about 1,000 passengers taken off the ship yesterday and about 1,000 passengers left on board. So Cal OES says the goal is to get those 1,000 passengers off the ship today, get them on the buses, on those chartered flights to take them to their quarantine locations. Of course, they will be quarantined for 14 days and they will stay in those locations. If they do show any symptoms, they will be transferred to different hospitals. So this is, of course, a developing situation. We've been out here all morning long. We've seen a lot of those passengers posting on social media. A lot of people are trying to stay positive about this whole situation. But of course, after being on this ship for more than 2 weeks now, between actually the vacation part of the trip and being stuck here in the Port of Oakland and kind of circling around the Bay Area for those couple of days before actually getting to the Port of Oakland, of course, there is a little bit of frustration. But really the goal is to get those people off that ship today. And there are about 1,100 crew members on the ship as well. They won't be disembarking. They'll stay on the ship. We don't know exactly what their quarantine plans are just yet, but we know that they'll stay on the ship and they'll actually go to another location. They'll set sail, go to another location for their own quarantine. At the Port of Oakland, Sarah Zendenam, KTVU Fox 2 News.
Sarah Zendenam there at the Port of Oakland. Thank you so much. A live look here at the Grand Princess cruise ship as there are still people on board there. I'll take you about maybe 50 miles to the south here, and we'd like to bring in another reporter from KTVU Fox 2 in the San Francisco Bay Area. Ali Rasmus, you are in San Jose, which is in Santa Clara County. That county has some very strict restrictions on large gatherings. And also at the airport there was a discovery of 3 TSA agents found to have COVID-19.
Yes, 3 TSA officers here at San Jose International Airport found to have tested positive for COVID-19 coronavirus. And throughout the morning, we have been pressing the Transportation Security Administration, the San Jose Airport, and Santa Clara County Public Health for more specific information about these 3 positive cases. For example, we don't know yet where in the airport these 3 officers worked. We don't know how many people they may have been exposed to. I'm going to read to you the only thing that the TSA is saying to us, a statement. They said, quote, "The officers are receiving medical care and all TSA employees they have come into contact with over the past 14 days are quarantined at home." Again, we don't know how many people they've come into contact with. Now, when we asked the TSA for more specific information, they referred us to the Santa Clara County Department of Public Health, and they sent us a statement that was very general, saying the risk overall to the general public and passengers, travelers coming through this airport is still relatively low. But we have also talked to off camera some people who work here at San Jose Airport. They didn't want to go on camera. They were afraid of getting in trouble for speaking out at work. But a lot of workers here at the airport we've spoken to say they are concerned about their possible exposure. They would like to know, were they working with these coworkers? Are other people they work with experiencing symptoms and feeling sick? Were the 3 infected officers taking the employee parking shuttle that dozens of people take every day? So still a lot of unanswered questions and not a lot of specific information from the TSA, from San Jose Mineta Airport, or the County Department of Public Health about this particular situation with these 3 TSA officers who tested positive for coronavirus. Now, separately, the County of Santa Clara has declared a ban on all events with 1,000 people or more, gatherings including sporting events, concerts, performances. That is going to go into effect until the end of this month. Obviously, a lot of businesses in the area are very concerned about the impact this is going to have in downtown San Jose and throughout Santa Clara County. But Santa Clara County is the hardest hit in California when it comes to the number of coronavirus cases. So public health officials say this was really, although drastic, an essential step in stopping the spread of the virus. Gasia?
Ali, let's go back to the 3 TSA agents you were just reporting on. We have heard from doctors in the past couple of weeks say when they have someone test positive for coronavirus, they try to trace that person's last steps, right? Where did they go? Who did they have close contact with? When you talk about TSA agents at one of the busiest airports, certainly in the state, if not the country, it seems almost impossible to try to even put a number on how many people each of those 3 agents came in contact with and then find those people who could be anywhere in the world.
Yeah, a monumental task to try and track down every single person a TSA agent may have come in contact with. And again, we don't know when these TSA agents were tested. We don't know when those test results came back. We don't know if there are other people, other coworkers of theirs that may have gotten sick. I want to read the very generic statement that we got from the Santa Clara County Department of Public Health in response to those questions about are travelers at risk. And they say, quote, "The risk of transmission is extremely low for individuals who aren't in close proximity for an extended period of time. Public Health Department is following up on cases with close contacts. Risk would be higher when sitting in close proximity to a person for multiple hours versus quick contact passing by an individual." Now, obviously, that statement is meant to try and reassure travelers who may have gone through San Jose International Airport in the last couple of weeks, may have come in contact with these 3 infected TSA officers. But again, that doesn't address the concerns of some of the people who work at this airport, right, who may have had more prolonged contact with these 3 officers. But this morning, I have to say it's been very challenging trying to get specific information from the Transportation Security Administration, the Santa Clara County Department of Public Health, and San Jose Airport. Not a lot of details coming out even when pressed.
Challenging for you and certainly frustrating for all those people who are hearing this news and thinking, wait a minute, I just flew through San Jose a couple of days ago. It also leaves many people to fill in the gaps, if you will, when they're not being given a definitive statement. I interviewed a doctor in just the past hour who said close contact isn't nose to nose. It's not, what you typically consider a romantic or intimate situation. This doctor described it as anywhere between 3 and 6 feet. And I've been at those TSA checkouts, right? You put your stuff in the big gray plastic bin, and I'm well within a foot or 2 of the agent who's, digging through my purse and making sure I'm not, taking a can of soda on board.
Yes, and they do wear gloves, when they go through people's bags and do a more extensive search, but think of all the hands touching all the things at the airport in general, let alone going through that security checkpoint. Now, we asked specifically, where do these TSA officers work? Which terminal? Do they work at the security checkpoint? We don't know. That's information and questions we still have not been able to answer. Certainly, if we got some answers, we'd be able to fill in the gaps for folks who may be wondering and may be concerned.
And Allie, let's shift to the second part of your reporting here, the fact that large gatherings are banned where you are in Santa Clara County, specifically San Jose, the biggest city in the San Francisco Bay Area. This means no Sharks hockey games. This means a number of events. I think Tony Robbins was going to speak there. Typically thousands would come to something like that. So you have to talk about weighing the immense financial hit that organizations are taking with the heightened concern, especially given that I'm sure you know the breaking news. The WHO has now just called it a pandemic. It's no longer a coronavirus crisis or alert or outbreak. It's now reached pandemic levels.
Yes, I think we haven't fully yet felt the local impact or economic impact of social distancing and what that really means and how that affects businesses large and small. It's certainly something the San Jose Chamber of Commerce and businesses here are very concerned about, and small businesses, this is going to be something, this is terrifying for them. What is this going to mean when no one comes into their shops, into their restaurants? We haven't yet seen the full impact of that, but businesses are bracing for it.
Right. I know a lot of, especially small businesses, like you mentioned, mom and pops, they don't have the immense financial cushion perhaps a larger corporation might have. I know I've just heard anecdotally, and maybe you've heard this as well, reports of shops saying, I may have to close for a few hours, or I might have to lay some of my part-time workers off. So it seems as though, individuals who haven't been affected yet may be feeling the pinch very soon.
And there's also, I want to mention about the mass gathering of 1,000 people or more ban. There's been some questions, and I have to work to try and get some more detailed information on it about what exactly qualifies as a gathering of 1,000 people or more. Is it 1,000 registered attendees, say for a marathon or an event or some sort of a conference going on, or is it fewer than 1,000 registered, but then does it include all the people who show up at that marathon or running event to support the registered attendees? So this is still all being worked out. This is still new territory for a lot of folks to try and figure out the impact of this and how exactly it's going to play out.
And as far as you know, is the ban that you're reporting on there in Santa Clara County the strictest of its kind when you look at the Bay Area as a region as a whole?
I'm sorry, Gasia, I couldn't hear that last part. The ban, say that again? Is
the ban there in Santa Clara County the strictest among all the Bay Area counties if you look at the region as a whole?
It certainly sounds like it. We have heard other counties, Marin County, Contra Costa County, have put limitations on gatherings of smaller numbers of people, but so far this seems to be impacting more of the schools and community events, not so much large-scale concerts and performances and sporting events like you have typically at the SAP Center.
Allie, I know you live and work in the San Francisco Bay Area. That is one of the hot spots, if you will, for coronavirus cases being detected in your state. What do you see in your daily work, school, grocery store? What are you seeing out and about?
Well, definitely things seem quieter when you go to shops, when you go to restaurants, when you go to businesses. When I walked into the airport here, there are still people coming into the airport, although we noticed people, some with masks, some even had plastic gloves to handle their luggage. And these weren't healthcare workers. These were just regular passengers getting ready to board a flight. But in talking to a lot of people here, they said that this is just their new reality. They don't want to stop traveling. They don't want to cancel their plans. We talked to one couple earlier this morning who were heading to Hawaii with a wedding dress. They were going to get married in Hawaii, and they weren't going to cancel that. They weren't going to stop that. But people definitely say they are being more vigilant. I stepped in here to just use the restroom, and coming out at the hand washing or at the sink, I noticed everyone next to me was really scrubbing their hands for a good 20, 30 seconds. It seemed like one of them joked, we're all Lady Macbeth now. We're all really washing our hands. So right. I think people are getting the message that you have to be vigilant, and they're taking that to heart. But I don't think it's reached that crisis point where people are ready to just shut themselves up in their house just yet.
Right. All right, Ali Rasmus from KTVU Fox 2. You're there in Santa Clara County, home to San Jose, the largest city in the Bay Area. A lot happening and changing there. We'll put her on a quick hold, bring Ali back into our coverage as needed. Next, I'd like to go to a doctor, bring in Dr. Robin Patel with the Mayo Clinic. You're also president of the American Society for Microbiology. Yes. Thank you for joining us, Dr. Patel. I'd like your reaction to the WHO's announcement in the past 25 minutes or so that the coronavirus is now at pandemic levels worldwide.
Well, nice to talk to you again. Yes, I saw that. I think we've all been anticipating that this would happen. I think you have to understand that there's not something dramatically different that happened between yesterday and today. This has really been an evolution, and I think many of us were expecting this announcement. So I guess it's best to just say I'm not surprised about the announcement.
And so even though the general public may feel a heightened sense of anxiety, from your expert view, is there a reason to?
I don't think there's a reason to feel a higher level of concern today versus yesterday, because we have been dealing with this crisis for several days. But I think that people should understand what this virus means to them personally and what they should be doing in the context of this virus. Anxiety is not a good thing, right? Anxiety itself, if it gets to be at too high a level, can really be detrimental. So I don't want to emphasize that people should be anxious, but I think people should understand what is happening with SARS-CoV-2.
So once they understand what's happening and they digest the news from just now, is there anything different they should be doing?
I think it's important to pay attention to what's going on in your own community, in your city, in your town, wherever you are in the United States or elsewhere in the world, because the epidemiology of this virus is really different in different areas in terms of the numbers that we know are affected or not affected, right? So if you're in a region of the world where there are a lot of cases, your response currently may be different than in an area where there are very few or no cases right now. And your public health officials should be letting you know what you should be doing. If you work, your place of work is likely developing or has developed a plan and is communicating that, I think people should expect that that could change, right, day by day, because the situation with the virus locally could change as well. Same thing would go for schools. You know, schools will be deciding what they will or won't be doing in the context of what's happening. And so you should stay in touch. You should expect that there may be changes over time and be responsive to those changes. At the same time, I think that just as people have been doing in the days past, you should think about yourself personally, your family members, the people that live in your household, and what you ought to be doing or thinking about. Trying to keep yourself safe, first of all, as much as possible, and trying to keep others safe. I think part of the reason for declaring this a pandemic is that we, throughout the world, need to be working on trying to protect ourselves, but others as well. That's why it's a public health emergency, right? But also thinking about, well, if I do happen to get sick, you know, what is my plan? In other words, you know, where am I going to go? Who am I going to call? And so on and so forth. Right. So I think just thinking about it personally, and it doesn't have to be complicated, right? Just have, you know, some sort of a plan or a thought process around that.
And I know we heard the head of the WHO refer to alarming levels of inaction shortly after he made the announcement about the pandemic status. I'd like to put you on a quick pause, but then we'll talk on the back end of this. Dr. Drew Pinsky spoke with Fox 11's Alex Michelson on the question that many people have. We're coming up on spring break. A lot of people have already planned their summer travel. People want to know, should I take that cruise? Should I take that flight to Hawaii? Let's listen now to what Dr. Drew Pinsky had to tell Fox 11 in Los Angeles.
High-risk people, smokers, people over the age of 65, people with chronic lung disease, people with immunocompromise ought to be curtailing their travel, and they should not be going on a cruise. I'm going to repeat this several times throughout the show today. The difference between influenza and the coronavirus, influenza, we have a vaccine and a treatment. Corona, we have at this point only containment. So the people that do those sorts of interventions are actively pursuing them, and we need to follow their directions. The rest of us, carry on.
So would you go on a cruise?
Yes, absolutely. Look, I flew to New York. I'm here. I took the train to the subway to this station tonight, and I have no qualms about it whatsoever. Wash your hands. Here's the message I'm going to repeat throughout the show today. Wash your hands. Wash them regularly, and get your flu shot. That will reduce your risk of really developing any serious problems this season.
You know, there are people that hear that this is deadlier than the flu in terms of the percentage, and that they're scared because there is no vaccine for this. What do you say to those people?
I would say most of that data is wrong. As we are learning more that this is more widespread and milder than previously reported, the denominator is changing, and so the fatality rate is dropping. South Korea is a good epidemiologic study of what the risks really are, and it looks like in South Korea it's less than 1%. That fits what I think is going on here.
Yet despite that, we see all of these events being canceled. We had the big tennis tournament out in Indian Wells, the BNP Paribas, that's canceled. Reporters not going to be allowed in sports locker rooms anymore. There's debate over whether Coachella should be canceled. They're considering playing sports games with no crowds. That's actually happening in Italy in some places. What do you make of all that? Overreaction?
Yes, go to a Laker game. By all means, don't stay unless you're in a risk category. If you're in a risk category, curtail some of your activity. And I can understand these sports teams with very expensive athletes in the locker room may not want to risk any exposure. In fact, wouldn't be a bad idea during flu season generally to not allow anybody in there who has any symptoms whatsoever into a locker room. But the probability of you getting coronavirus if you're in a non-risk population and going to a sporting event is exceedingly low.
Dr. Drew Pinsky there speaking with Fox 11 about perhaps an overreaction by some people in regard to the coronavirus now pandemic. I'd like to take you live now to Washington, where the governor of Washington State, Jay Inslee, is announcing new community measures and social distancing plans to help contain the coronavirus.
Your physician or your hospital, they discuss with you the advisability of delaying elected surgery. Please listen to them in this regard. We may need real critical care for thousands of people in the months as we go forward. I want to talk about schools. People are intensely interested in this issue. We have been doing a very, very deep search into the science about how to reduce the transmission rates associated with our children. The good news is that our children are relatively free of serious disease associated with this. But the best science tells us they still have the capability of transmitting the disease to other people they come in contact with. And so we are giving intense thought about what we can do in regard to our children. In that regard, I'm asking all of our school districts to immediately begin contingency planning for potential school closures in the next several days. We are asking them to do so because we know they care about our kids, but we also know that the schools can help us on providing the nutritional needs for children if in fact closures are required, and they can help consider what we can do for child care for parents if in fact closures occur. This is very important as we think about this, because we don't want to have nurses have to leave their employment at a hospital in the middle of an epidemic because they don't have child care resolved. So we're asking our school district leaders to bend to this task of figuring out what we can do in the event we have to make these decisions. It is expected I will give more guidance in the next couple of days in that regard. And I'll be talking to superintendents of the 3 counties I've talked about this afternoon. So I want to, conclusion, thank Washingtonians for helping lead the nation. Unfortunately, we know that the rest of the nation will be where we are perhaps in a couple or 3 weeks. And we hope that the things we're doing aggressively here can set a template for the rest of the country. I've talked to several of my colleagues and shared our experiences to date. and we want to help the country understand how to have a very vigorous, successful slowing of this epidemic. So with that, I want to now turn it to, is it Dow, are you up now? I'm to Dal Constantine, who's doing a great job as our King County executive.
Thank you, Governor. Thanks to all of you for being here today. Welcome to King County's King Street Center. This is the headquarters of our Metro Transit, as well as many other agencies. I'm joined by...
Just a minute ago, we heard from Washington Governor Jay Inslee issuing some very, not stern warnings, but really important information, and essentially saying that as difficult as things are right now, his state has the most confirmed coronavirus cases of any state in the country. It sounds like things are expected to get even worse. He said, listen to your doctor, and said, if you have surgery that's planned in the coming weeks or months and your doctor says, let's postpone that, take that advice and make that move, because he says hospitals and medical facilities may have to prepare to care for, in the governor's words, thousands of patients in the days to come, days, weeks, months to come, as it relates to the coronavirus. We also are focusing on schools, of course, because many parents are concerned about what's happening with their children. We heard the governor say, repeat information we have already, but it's important to note, children do not appear to be specifically threatened very much by the coronavirus. However, they can transmit it even without them getting very, very ill. So now the governor is faced with possibly making a decision that could affect tens or hundreds of thousands, really, of families across Washington state. Let's focus on Seattle there, a big city there up in Washington state. I'd like to bring in Matt Lorch from our Seattle sister station there. Matt, you were listening in to the governor's press conference with me. Let's talk about specifically what's happening with schools in the Seattle area. The Seattle School District is home to almost 50,000 students, and it looks like schools might be on the verge of closing.
And that's what a lot of parents were listening for in this news conference. Many parents have been wondering, why are we still sending our kids to school when the big employers in this area, Amazon, Microsoft, Facebook, and others, have said work from home? So I think the optics have many parents wondering what's going on. To this point, 115 schools in the greater Seattle area have closed for at least a day because of a possible exposure to coronavirus. One of the biggest school districts in the state, the North Shore School District, which is just northeast of Seattle, made the decision last week to close all 33 schools in that district. That's after a parent volunteer tested positive for the coronavirus, and there were others who may have been exposed. The superintendent actually of that district took a lot of heat for closing those schools. Many parents came out and said, how can you do this? We don't have childcare for our kids. At this point, the public health department for King County and Seattle was not suggesting that school districts close down. In fact, as you ask about schools, right now school districts have been told to follow the local public health recommendations. And here in King County, which is the biggest county in the state of Washington, public health has said to this point, only close a school if you have a positive case of coronavirus. Still, many private schools are being proactive. Several have shut down for at least the month of March. But for now, the governor is saying, okay, we're going to stop all public events by order of the governor through the month of March. And many businesses were waiting on bated breath, saying, okay, how long is the governor going to do this? He just said through the month of March, maybe longer, but he's pulling up short of calling off schools. Now, the superintendent of public instruction, who's the chief educator up here in the state of Washington, said that he didn't believe that the governor was going to cancel schools with this announcement, but that could be coming in the coming days. In the meantime, if you're a parent, you're like, oh my gosh, if they start canceling schools, our kid's going to be in school to make up all that time into July and August. And the chief educator in this state said, look for an emergency order from the governor if we start canceling schools, so that will limit the number of required instructional hours, basically freeing up schools to not go past June 19th. Here in Washington, that's kind of the critical cutoff date. So it sounds like cancellation of schools could be coming, but the Governor Jay Inslee here in Washington wasn't ready to go there just yet.
Now, some people might make the argument, I'm talking to you from a city that went through a teacher's strike in the past year or so. It lasted about a week and a half, and a lot of parents banded together. Look, you take the kids on Monday, I'll take them all on Tuesday. My husband calls in sick on Wednesday, and we made our way through. There is the argument, however, that if schools close, parents will fend for themselves, and schools are likely in a better position to have some semblance of order or cleanliness, or at least procedure, to help the thousands of children who count on those schools every single day. If you close the schools, where are the children going to go? You might see 7th, 5th graders at my house, right? All huddled under the same, blanket, eating from the same bowl of popcorn, watching movies all day. How is that better in keeping people safe than having them in a classroom?
Yeah, I think many people are asking those questions, and really the pressure is on superintendents to decide whether or not to close their districts. As I said, the superintendent in the North Shore School District, she oversees 30 plus schools, and she decided to close those schools, and some parents were outraged. Others may look back and say, oh my gosh, she was ahead of the curve. The concern is that kids, while they may not show symptoms of the virus, may carry it. And actually, I went out and covered a story last week about a group of middle schoolers in Kirkland, which is where the Life Care Center of Kirkland is located, where we've had this outbreak of coronavirus that has killed so many elderly folks. And they're right down the street, and they started an online petition. The kids saying, we're concerned about putting our loved ones at risk. We think schools should be canceled. Many of those kids, their parents have been keeping them out of school. And up here in the Pacific Northwest, those have been considered excused absences at most school districts. But yeah, you hit on this. I mean, these are the questions so many parents are having, is where is the safest place for our kids to be? Right now, most superintendents, until they're told otherwise, are saying, you know what, that's in school. And the schools that have canceled because they need to scrub down because there is a potential or confirmed case of coronavirus in either a staffer or a student, they're now working to provide meals for those students who get those services through the schools. So it's very complex. It's very difficult to understand how we serve not only these students, but those families who need us during this critical time. I will say the other population that's really impacted by what the governor just said is businesses. And already we are seeing restaurants here in the Seattle area close down because they don't have any customers right now. Nobody's showing up, and they don't want to keep the lights on and pay all their employees. Sure. And they've made the strategic business decision to close down. And so all these local businesses were really awaiting to see what the governor was going to say with this news conference. And it was really interesting. The governor said, listen, we want businesses where 250 plus people to congregate to really think about this, or all businesses to really think about this, not only for your employees, but for your customers. Right. And so they're asking everybody, have some skin in the game. It's difficult if this is your bottom line, this is your income, this is how you feed your family, to make these decisions. But the governor and public health officials are saying, come on, we're going to rely on you during this critical time of crisis. Right. You just think about how these next few weeks could affect, a mom and pop operation that's been up for 20 years and running. You would hate to see that company or any company fail. All right, Matt, thank you so much for talking with us from our Fox station up there in Seattle. Let's go halfway across the country and to the state of Texas, where officials have made the decision to cancel the Houston Livestock Show and Rodeo. It's a multi-million-dollar operation. Let's listen in as we get the latest from Houston.
Many nations coming up with many, many cases, and the spread is occurring very rapidly. Within that spread of the people who get ill, we do know that about 80% of those folks have minimal or mild symptoms. To some degree, that's a bit of a problem because those folks are probably the ones who are spreading it throughout the rest of the community. There is a subset of the population, about 15% of the population, who requires hospitalization. There's another percent of the population who's requiring intensive care level care, and they're on in critical condition, and we're seeing waivers, the number of waivers, but we're seeing about a 2% death rate from this. So the death rate appears to be predominantly in people over the age of 50. That seems to be the highest percentage, but depending on which decade of life, 50 to 60, 60 to 70, 70 to 80 or above, it's 5, 8, 10, as much as 15%. We're doing this in order to save lives. This is a very big step that the mayor and the judge are taking, but it is to save lives. If we are successful with not only the things that this community can do, what government can do, but what you can do in terms of social distancing, washing your hands, covering your cough, not going to work when ill, those things. When we do those together, we can slow down the spread of the virus through our community. And it's important that everyone understand that that is what did not happen in Wuhan. It exploded in Wuhan. They didn't know it was coming. They had no warning. They had no time to prepare. They had no ability to slow it down. And it completely overwhelmed the community and, importantly, their healthcare system to the point when people needed a hospital bed, there was none available. What we are trying to do with these very aggressive and, yes, painful decisions is to slow down the virus, because we have every reason to expect that at this point, hopefully I'm wrong, but we have every reason to expect that it can spread to many, many people in our community. With 80% of the folks having minimal or mild illness, if that happens over a long period of time, we'll be able to handle that. But for those percent of folks who need a hospital bed, there needs to be a hospital bed available to them. So if everybody gets sick at the same time, we won't have a hospital bed available. And afterwards, we have a graph over here to the right, a chart that you can look at. We can talk about it later that kind of shows that in a graphic form. But I want to remind everyone that everybody up here understands how difficult these decisions are, how painful it's going to be to some folks. But we're doing it in order to save lives of real people. And if we are successful, we will look back on this and say, well, you know what, it turned out not to be such a bad deal. Well, if that's the case, and we're seeing what's happening in Italy, for example, then that will be because of all of these things that we have done. It won't be because those things were unnecessary. It will be because of the steps that we're taking, like the steps we're taking today. And the option is to not do these things, in which case we would certainly expect to have a Wuhan situation. That is not acceptable. So as painful as these things are, I want to remind everybody, we're doing this in order to save lives. Thank you.
Listening in, taking you live to Houston, Texas, which is one of the reasons we're doing this daily live update for you for 2 hours here, starting at 1 p.m. Eastern, 10 a.m. Pacific. We mean to give you the very latest information on the coronavirus crisis, which is now being called a pandemic by the World Health Organization, and also take you live to cities around the country where news is breaking, as is the case in Houston. The city has just said that it will not hold the annual Livestock Show and Rodeo. This is a huge deal in the city of Houston, a multi-million-dollar operation that draws people from all over the country. The Houston Livestock Show and Rodeo will not be going on this year because of the coronavirus now pandemic in the United States. Let's talk a little bit more about what's changing today, and I'd like to welcome in, actually before I do, a quick note. Got some information here from San Francisco that the city is strengthening its urging of people not to attend group events of 1,000 or more people. So that coming to us out of San Francisco in the Bay Area. Let's welcome in Mary Joropini. You're a psychologist there. You are in Houston. A lot of people are talking about the anxiety they're feeling. A lot of people say, look, I've washed my hands. What more can I do? Can you address those concerns?
I think it's a real thing. The only constant in life is change, and uncertainty creates lots of anxieties, especially if you have PTSD or one of the other mental illnesses such as depression. The most important thing at this time is you take care of yourself, that you remember you're a mentor for your children. So the more you can stay calm, the more you can keep your routine in life as stable as possible, the better everyone is going to do.
Well, let's talk about that. I'm a parent. I have 2 little boys in elementary school. They have heard about the coronavirus. We talk to them about it in terms of we should always wash our hands, you know, don't come in close contact, that sort of thing. But then they asked me at the dinner table the other night, but aren't people dying from it? I'm always honest with my boys, and I had to say, yes, they are. How do you approach that very delicate subject?
And that's a really good question. I think the most important thing for your child is to reassure them, and kids like to know they have control. Yes, people are dying from it, but most of the time, most people don't. So what can we do as a family to unite? One thing, maybe you postpone your spring break, you stay home, you play board games, you write letters to people in the hospital who are sick. Anything you can engage your child in that's going to make them feel like a helper, more in control, and that their parents are going to keep them safe is what's really important. And I think parents keep their children safe when they keep the routine stable and when parents stay calm.
It can be very difficult, and I speak from experience, to feel fear on the inside, but project calm when I talk with my little ones.
Yes. I think things like, say, admitting, you know, this is scary and it's uncertain, but we've been through times like this before when parents are able to read books about uncertain times or relay times in their life when they got through difficult times. Telling your child it's okay to be afraid. Being afraid is a survival tactic, but what you do with your fear is what separates being in control of yourself, staying calm, and just losing it.
All right, Doctor, thank you so much for joining us. Mary Joropini, based out of Houston there. Thank you for joining us for those calming words. We'll have to remember them as the day wears on and the news changes minute by minute here as it relates to the coronavirus. The big news that we got just about an hour ago from the WHO is that the WHO now considers the coronavirus outbreak a pandemic, and that is taking a worldwide look. Here in the United States, Washington State still has the most cases with 267. We just heard from officials there, the governor, it sounds like schools might be on the verge of closing in Washington State. We know that a number of schools are closed in the San Francisco Bay Area. So again, it's a situation that's changing minute by minute, and that is why we are here to bring you the newest information and to help you understand what's happening and, most importantly, how it affects you and your family. So again, on this national map, we see in bright red there, the top left-hand side, that is Washington State. It has the most cases, 267. Just to the south there, we see California has 181 confirmed cases of the coronavirus. Next, we have New York on the East Coast, also Massachusetts there, and then Florida has 23 confirmed cases of the coronavirus. We have heard doctors say they expect these numbers to change, and they have been, even just in our time here with you on the air. If I can, I would certainly like to go back to our Dr. Patel, who is standing by to answer some questions. We've talked about hand washing. We've talked about happy birthday twice, you know, hand sanitizer, Clorox wipes, all of the above. We have been soliciting throughout the country questions from our viewers. And I always say, you know, questions are free. That's one of my favorite things to say. So the first question we'll get to from one of our Fox viewers here on this live stream is this one. Can I get the coronavirus from food? What do you say, Dr. Patel?
Oh, well, first of all, that's a great question. And I'm glad people are thinking about how they might get this virus or not, because I think that's really important. We do think about food a lot when we think about infectious diseases. We have what are called foodborne illnesses, things like Salmonella, Shigella, Campylobacter, and so forth. I won't use a lot of technical language, but those are microorganisms that are most commonly transmitted via food. So we're used to, say, food recalls or be careful about certain types of food or how you cook your food and so forth. The really good news about this virus is that it is not a foodborne illness, right? So it's not, its primary means of transmission is not via food. Your food that you buy at the grocery store or in a restaurant should not be coming contaminated with this virus.
Okay, let me ask you a question.
I suspect I know what people are thinking, right? But couldn't a human get the virus onto the food somehow and something happen in that way?
Right.
And so, I mean, the main means of transmission is not foodborne like we think of foodborne infectious diseases. If someone who is infected with the virus is handling your food and your food's not cooked, say, I don't know, a sandwich or something like that, and they're, you know, coughing onto your food and touching it with their contaminated hands, and then you're eating it, of course, that could be transmitted in that way. But I think you just need to think about that as far as how this virus is normally transmitted, right? It's droplet spread, and then it's contamination of the droplets from an infected person. They don't have to be symptomatic, but from an infected person into the environment that's just around them, the surfaces that are around them. So that could include food.
Okay.
But
yes,
again, there are safe ways of handling food that should really prevent this.
Okay, but it sounds like you're telling me not to finish my little son's sandwich that he brings home from his lunchbox. So I will stop doing that, as I think every parent has finished their little one's lunch. All right, let's switch to another question from one of our viewers on this Fox live stream. A viewer asks, what is the difference between COVID-19 and the norovirus?
That's also another very good question. I think maybe the connection that people might have is they're both viruses and they both have an association with cruise ships. I'm trying to think of where that question came from. They're viruses, but they're very different types of viruses. So norovirus is a virus that causes gastroenteritis or diarrheal disease. It typically causes a very acute diarrhea, vomiting type of illness. I suspect a lot of viewers have had that and can reflect back onto that experience. It comes very quickly and typically disappears very quickly. In contrast, this virus is a respiratory virus. You get it into your respiratory tract, typically your upper respiratory tract, so the nose, kind of back of the throat type of area. And sometimes, not in all cases, but sometimes it goes down into the lungs and causes a pneumonia. Norovirus just doesn't do that. So completely different kinds of viruses. That being said, you could potentially acquire norovirus from contaminated surfaces, just like you could with this virus. So there are, some pieces that are in common, but essentially the disease they cause, the types of virus that they are very different. Like this virus, we don't have any great treatment for norovirus, and we don't have a vaccine for norovirus.
Okay, Dr. Patel, thank you. We're going to put you on a quick hold here and go to the Washington, D.C. area. We have reported on a number of events such as the Houston Livestock Show and Rodeo that are canceling because of the coronavirus crisis. We know South by Southwest was canceled in Austin, Texas. That is the case in many states around the country. So I'd like to bring in Blair Candy from the D.C. area. You are from Show Call, and you handle these large events, many of which are having to be postponed or canceled entirely.
Indeed, Gasia, thank you. Quite frankly, the meetings and event industry is in an apocalyptic state at this time due to the number of cancellations, postponements, and just flat out events going away. We are all the event planners, the producers, the service providers, the technical companies are really just spending the majority of our day, the last few days, most intensely, fielding these cancellation calls. There are a number of clients that are they're adapting to it. We are adapting with them, ways to bring events to a public audience without the public being there. We adapt through streaming, the way that this broadcast is happening right now, and many events are going that way. I will say that clients are being very contemporary in their approach to this. Most events are saying, how else can we do this? How else can we move forward? I think a lot of the fear that people experience gets compounded when we sort of stop moving forward, when we stop going forward and making progress, and that's when the panic sets in. So I think what we're finding is those folks that say, hey, let's do this a different way, let's adapt, and let's move forward, are going to ultimately be the most successful. But without a doubt, the financial hit to the small businesses, even the large businesses, is absolutely tremendous at this time. It's really unprecedented. We have a few benchmarks within the event industry. We have 9/11 as being at a time when everything just stopped. Everything stopped. But immediately the country moved to, let's rebuild, let's put this back together. We had the 2008 financial crisis. It was sort of a slow break to a complete halt. But then again, the government stepped in and through financial aid to a variety of different entities, everything came back. And it came back very quickly in comparison to what the overall crisis was doing to the environment. And so today, the really difficult part is that from an event and meeting perspective, as planners, and that's what we are, that's what we do, we don't know where we are on this hill. We don't know if we're at the apex yet of this issue. If we look back at China, okay, that was December, and now they seem to have at least sort of contained things, and they seem to be rebounding. I know commerce is moving in and out more so than it was before, and so we have to look at, is it first quarter and second quarter that's gone? Is it first, second, and third? The ramifications between those two differences are going to be tremendous. And a lot of the gig economy, quite frankly, those freelance folks that have really prospered so much in this terrific economy that we've had over the last few years, are the first ones that are going to take the biggest hit. they don't often have the reserves. And so, what we all have to do is we have to try to remain calm, keep the panic down, and just continue to be flexible. Again, we have that flexibility because of the nature of the business that we do, because we plan big events with lots of lights and speakers and stages and cameras. But what we are doing is working with our clients. We're working with universities to start streaming graduations and start developing plans for that, right, because the reality is they're probably not going to put 10,000 people in an arena.
Right. Now, let me ask you about this, Blair.
Masses. Go ahead.
I know it is a poor substitute for getting 10,000 people in an arena, or even 1,000 people under a dining tent and having them all focus on one thing, be it raising money or changing the world. Is the online capacity a drop in the bucket when it comes to gathering minds together, or perhaps fundraising, anything that can be done not in person? Can any of that be done online, or is that not even really worth the time?
No, it certainly is. And I'm not going to say that losing a $600,000 conference to do a $20,000 streaming version of it isn't going to be a major hit. But the reality is that you can. Is it going to be the same? No. But the meetings and event industry isn't as big as it is. It's as big as it is because meeting people face to face and shaking hands is, quite frankly, the best way for people to develop relationships and do business with each other. And that's why meetings and events work, and that's why that industry has gotten so big. But there are ways that in these times when we can't shake hands and we can't pat each other on the back and sit down for a coffee at a conference, that we can bring some of that interactive element to the cloud. And we can do some of it through streaming. And for example, we're working with a client that's going to take their annual fundraiser, right? And this is all the sort of, I'm not going to call it the trickle down, but the trickle out effect of all of this.
Well,
is you have things like nonprofits that rely on that 500-person gala.
I'll interrupt you to bring in some breaking news here. I just learned that from Seattle, the Mariners have decided to move their home games out of Seattle through the end of March, and that is because of Washington State's ban on large group events. I know San Francisco is banning large events of 1,000 people or more, very similar happening to what in the county that houses San Jose. So you're seeing this happen, not just sporting events, work conferences and everything in between. So thank you so much for joining us. I wanted to make sure our viewers got that breaking news. Listening there to Blair Candy from Show Call in the Washington, D.C. area. If you've just joined us here in the past hour, we're going to continue our live stream here because it's important to note the WHO, the World Health Organization, as of about an hour ago, is calling the coronavirus outbreak now a pandemic, and that is with that worldwide view. If we have a second to pop up stocks, we have to keep monitoring what's happening on the Dow Jones, because yes, we saw a bit of a bump yesterday, but not the case now. I'll just go ahead and peek here because we have been sharply in the red, and this is down by about 1,200 points. The Dow Jones is down by more than 5%. S&P is down by more than 4%. NASDAQ is the same. So again, there's a lot of news happening as it relates to the coronavirus and how your life directly is being impacted. So that having been said, we'd like to remind you that we are joining you every day here starting at 1 o'clock Eastern Time, 10 a.m. Pacific. Some of our viewers might be stepping away to local programming now. We'll continue at your local Fox station and on social media.
air filtration machines to help sanitize the air, disinfect the air for the elderly. And like you said, we were on college campuses last week, a different generation, and now we are dealing with the elderly, the highest risk environment when it comes to these infectious diseases. So we're talking about more than 300 facilities here in the area that the LA County Public Health Department is going to, surveying these sites, and they'll be making recommendations to these facilities if they don't have the proper preventative measures in place. So we talked to a few executive directors of these facilities, and they say they're not worried, they're not scared, but they are trying to provide as much information to people who come through their doors. Another serious thing they're doing is checking temperatures and vitals for everyone who walks in. That includes doctors, staff, delivery personnel. The door, they checked my temperature, 98.4. They gave me the all clear, but they're definitely taking this seriously at nursing homes here across Southern California. 20 cases in LA County, 157 across the state, and again, we know the highest risk community is the elderly, and we heard from that doctor earlier in this show. Over the age of 50 is what most of the age groups that we're seeing this really impact.
Okay, Mario Ramirez live for us in Los Angeles there where things are changing as well. Thank you for joining me. Let's stay in California, go up to the top part of the state here, focus in on what's happening in the Bay Area. We brought you the breaking news just a few minutes ago that San Francisco's Mayor London Breed is really strengthening the urging from a public health leader, saying the health officer of San Francisco is issuing a public health order prohibiting all large groups of 1,000 people or more in the city and county of San Francisco to help prevent the continued spread of the coronavirus. So let's go ahead and bring in KTVU Fox 2's Christian Captain. You're live there in San Francisco. It sounds like we're about to hear the mayor speak on this.
Yeah, so Gasia, here's how we're hearing this is going to work. We will get a chance to talk with the mayor about canceling those events of more than 1,000 people after a news conference that's set to start at around 11:15. Now, at 11:15, we're hearing that a news conference is going to start, and at that news conference, the mayor will be there, as will the superintendent of schools and the president of San Francisco School Board and the Department of Public Health. So what we understand is going to happen is that this is going to be about San Francisco schools, whether or not they're going to stay open. You'll remember that the Catholic Diocese, the Arch-Catholic Diocese, closed some 90 schools in San Francisco, San Mateo, and Marin counties yesterday. A source with the city tells me that San Francisco schools are going to remain open. So part of the reason we are understanding for this news conference is to justify and explain why San Francisco schools are going to remain open. Following that, we are expected to be able to talk with the mayor about the canceling or postponing of those events of more than 1,000 people, so we can get some clarity on that. So a lot of moving parts here and a lot of rapid developments here in San Francisco. We're monitoring all of them, including at noon we understand that there's going to be a news conference from nurses who are asking for additional protections as they go into their jobs. So again, a lot of moving parts in San Francisco and a lot of rapid developments, Gasia.
And Christian, when you look at California as a whole, the San Francisco Bay Area is one of those regions that has a relatively high number of confirmed coronavirus cases when you look at California statewide. Let's focus in on what's happening in the schools there in San Francisco. You mentioned it sounds like the San Francisco Unified School District is going to stay open. I think it's home to some 54,000 students, and I know a number of schools, as you mentioned, within the Catholic Archdiocese have closed. I can imagine that it is all the talk among parents in San Francisco that if school closes, what do we do with our children? I'm guessing, you know, every parent is a working parent practically there in San Francisco.
That's right. And so keep in mind what that would do. And that might be part of the reason why they consider the schools an essential service in the city. And that's one of the reasons why they would try to keep it open as long as possible. If you were to shut down San Francisco schools en masse, what that would do to the workforce in San Francisco, you can just imagine, Gasia. You started touching on that. You'd see mass absenteeism from work as parents scrambled for daycare or said to stay home with their children. So it could certainly have a major impact on the economy of the city, the functioning of the city, and the infrastructure of the city. Because keep in mind, there are a lot of people here who are performing essential functions for the city, who do have children who are in school, and they need to make sure that those kids are taken care of. So that's one of the issues. And, you know, we talked about this before also, Gasia, that Lowell High School was shut down last week, reopening today, and classes are underway. Keep in mind it was shut down last week after the parent of one of the students at Lowell was found to have tested positive for COVID-19. Now they're reopening that school. So again, a lot of questions for the district on how they came about that decision, what factored into that decision making, and what it's going to look like going forward, whether we're going to see some individual schools perhaps targeted for closure if they have somebody at school who has a close tie with somebody who has tested positive for COVID-19, or whether they would look at closing schools en masse. Again, there's a lot of questions outstanding right now.
Okay, looks like you're just a few minutes away here from the start of that news conference. Again, you'll be hearing from the mayor of San Francisco, London Breed, the head of that city's public schools, as well as the public health director. So KTVU Fox 2's Christian Captain live in San Francisco, looks like inside City Hall. We'll let you go so you can cover that and then come back and let us know what the latest news is. So again, let's go ahead and focus on the fact that the WHO is now referring to the coronavirus outbreak as a pandemic, and that's looking globally. Here in the United States, Washington State still has the highest number of confirmed coronavirus cases. California, where Christian is reporting from, is not that far behind. Let's talk about the impact the coronavirus is having on business and specifically travel. You lump those two together, and that's why we bring in Angel Castellanos. You're a travel journalist. You're based out of LA. You were coming to the Bay Area, and then you got some news.
I got some news that the Bay Area Travel Show, which was supposed to be held in the Santa Clara Convention Center, was canceled. So I was one of many travel experts due to speak. There were thousands of vendors supposed to exhibit, and now that's not happening.
And so clearly Santa Clara County is one of the counties that is banning large gatherings of 1,000 people or more. I assume you're one of many people who are going to be at this conference. How does this impact you directly?
Well, you know, I was one of the speakers, so it has a financial impact, but it also has a deep impact on spreading the message on, you know, my travel philosophy, and also it's not just this convention that was canceled, but I was due to speak at South by Southwest. So again, it definitely is having a financial impact.
South by Southwest, which was canceled, by the way. I think it was just in the past week or so.
Absolutely, yeah. So I was supposed to speak there. So it's definitely having a financial impact on my pocketbook, because not only are my sponsors losing out on the opportunity, but I'm losing out on opportunities as well. Right. And this is having a major economic impact. This is the worst thing to happen to the travel industry since 9/11.
Let me run something by you that I'm hearing from an awful lot of people as it relates to travel. We're coming up on spring break. People are planning their summer travel, and I've heard from more than one person who says this: I can take a week off of work and go to Hawaii. I cannot add 2 weeks on the back end of that if I end up in quarantine. So a lot of people aren't just weighing the difficulty of traveling. They really have to look at it as almost, it's not a week vacation. It could be really a month total. You're taken out of society if the coronavirus comes your way.
You know, that's very true. That's something that all travelers really need to consider, to really look at the big picture. For example, Israel is quarantining all travelers arriving into the country. So it doesn't matter who you are. So that's why I think for those travelers who are, having trips come up here in the summer or for spring break, domestic travel is looking a whole lot more attractive these days. And I've never seen airfare be as cheap or as flexible as it is now since 9/11.
I know a lot of the time people don't like buying travel insurance. They think, you know what, I'll be okay. I'll hedge my bets. Are airlines, I know airlines are changing their policies when it comes to refunds, or more likely they'll hold on to your money but say you can use that at a later time for no extra charge. Do you think we'll see any lasting change within the travel industry as the result of this coronavirus pandemic?
You know, that really remains to be seen, because when it comes to travel insurance, it's really the cancel for any reason insurance that does most people any good. And even then, you only get about 50 to 75% refunded of your full trip. So that's why the individual vendors like airlines and like hotels are starting to slowly become a little bit more flexible, because we know as travelers that, they're notorious for having really harsh cancellation policies.
All right. Thank you so much for joining us, Angel. I'm sorry that you You missed your travel show, but at least you're getting your message out. And I know many people are concerned about certainly their health, but also their future plans. And it's hard to make plans when the unknown is ahead of us. So Angel
It sure
Castellanos,
is. Happy
thank
travels.
you.
Thank you.
And to you, thank you. Happy and safe travels, most importantly. Let's take you now to Wall Street. New York, stocks plummeted at the open, and we thought things couldn't get worse, but here, look, they have. It looks like they're the lowest they've been so far this entire session. Markets will close in about an hour and 45 minutes. The Dow Jones is down by 5 and almost 1/3%, losing 1,316 plus points. There is another sharp drop we're tracking over on the S&P. It is down by almost 5 full percentage points. The Nasdaq is almost there as well. Certainly all this action on stocks is due to the coronavirus now pandemic. Many investors were hoping for a clearer message when it comes to federal financial aid, either for companies that are struggling, perhaps, even down to the minute, person by person. If someone doesn't have good health insurance, will their can they get some financial help in coronavirus testing? If they're out of work for 2 weeks but don't have sick leave at work, can they get help for that? So we're watching stocks because they are once again taking a nosedive. Of course, yesterday we saw a bit of a bump, and then here we are. That is history. Let's go now to Phoenix, and we will hook up with Joshua Alt, Arizona State University's Thunderbird School of Global Management. We are looking businesses at a national and global level. I'd like to focus, though, on the most fragile of all, and I expect that to be those mom and pop businesses who are thinking, look, if this goes on for 2 weeks, I'm going to have to lay off workers or shut my doors.
Yeah, first of all, thank you. It's really good to be here. I think that you're absolutely right that, one thing that we have been teaching to our students, for years and years now is that no matter how local you are as a company, even if you just plan to operate in a local environment, just in the Phoenix market or the San Francisco market, we've gotten to a stage where, your supply chains could be spread out all over the world and are going to be impacted by this. And so this is something that we are actually working with our students is to develop this, transnational mindset where they are paying attention not only to just what's going on in their local markets, but also what's going on in the global markets that could impact the local markets.
So then what's your best advice for businesses who are facing uncertainty?
Well, I think that it's almost become a cliche now, but I think it just has to be reiterated that, it is not the time to panic. I think a big part of the issue right now in the business environment is that there's just so much uncertainty out there, and markets really struggle when there is uncertainty. They're not entirely sure how to deal with the situation. And so we're going to see a lot of these fluctuations going up and down, 5-10 points one day in the stock market, down 5 or 10 points the next day in the stock market. And so I think that what we need to do is, as small business owners, as investors, as everybody involved, is you have to take a step back and try to take your emotions out of it and just move forward according to your long-term plans, because eventually this is going to go away and we will get back to business as normal.
It was less than 2 hours ago, Joshua, that the World Health Organization said that it was now referring to the coronavirus outbreak as a pandemic. You don't hear that word too often, and to a lot of us, it's scary. We've also talked to doctors in the course of this live stream who say you shouldn't be more worried than you were yesterday because it now has a new name. From a business perspective, however, does that word pandemic make a difficult situation even worse?
I think that an issue that we have is that we're all human beings. We're all psychological beings. And a lot of times we hear these words and it's very hard to operate rationally. A lot of times we see what other people are doing, we see what other businesses are doing, and we're not entirely sure what the appropriate course of action is ourselves. And so we end up rushing out and just trying to copy what everybody else is doing. And I think that this explains to some degree, the hoarding mentality, everybody running and buying toilet paper at Costco and all of these, kinds of activities. So again, I think just the point is that, as this news is coming out, you need to do everything that you can to take your and I know that it's hard, but doing everything that you can to take your emotions out of it and really looking at this from the perspective of your long-term goals.
Is there anything that can be learned and borrowed and used when it comes to recovery? If we look as far back as September 11th, I remember there was a massive push that seemed to start in New York City, but then certainly went nationwide that said, look, go out to dinner, buy that new outfit, go see that show, take in that concert, essentially spend your money. We saw that after September 11th. We saw it after the massive wildfires in California, up in the wine country, promoting local tourism, trying to get new faces through doors. Can any of those lessons apply here?
Yeah, absolutely. I think that there are a number of lessons that can be brought up because of this particular case. I teach globalization, and I think you hit the nail right on the head when you mentioned that a lot of this seems to have started with 9/11, because that's really when we saw a shift in the business environment. Before that time, there was this euphoria about globalization. There was this idea that products and services could fly all over the world, from where they can be produced the cheapest to where they can be produced, where they are needed the most. And then 9/11 kind of put a change in that. And I think that a lot of these events that we're seeing, after 9/11, the Wall Street collapse in 2008, the migrant crisis in Europe, a lot of these things are causing people to wonder, is the cost of globalization really higher than the benefit? And I think that as far as this goes, I think that the virus is another step because it raises these important questions about our security, and does globalization make us fragile, too fragile as an economy and as a society? So I think that, kind of a two-part answer to your question, I think that this is going to push organizations, companies to think very carefully about their supply chains. It's another step in that process. I think for those of us, to answer your question more specifically, I think for those of us that are watching this happen, I think that you're exactly right. I think that it's all about trusting our business leaders, trusting our political leaders, trusting our economic leaders, and continuing with life as we know it, kind of like during World War II, be calm and carry on.
Right. My friends will tell you I'm the cheapest mom on the block, but yesterday our washing machine went out, and so we had to call the repair guy. And I actually felt good about paying him $375 to fix the thing, because I thought, you know what? He could use it. I need the washing machine. Let's do this. All right, Joshua Alt, thank you so much for joining us. When you're out in the Bay Area, come and let's go out to dinner together. Let's switch things now and take you across the country here, and let's focus on what's happening in Georgia, specifically Atlanta. We've been able to bring you a live look at what's happening at the Grand Princess cruise ship as it's docked at the port of Oakland. Some of the passengers we've watched get off the Grand Princess are now arriving at the Dobbins Air Force Base in Marietta, Georgia, near Atlanta. I'd like to bring in Deidre Dukes with Fox 5 Atlanta. Tell us what's happening and how your state is receiving people from California.
And Gasia, a plane filled with those passengers, those stranded passengers from that cruise ship in California, landed here at Dobbins Air Reserve Base overnight here in Cobb County. Cobb County in the city of Marietta is located about a half hour or so north of Atlanta. That 737 arriving here at around 1 a.m. this morning. I can tell you that more than 200 people, 200 passengers from that cruise ship are expected to be quarantined here at Dobbins, and we are told that a second plane actually is scheduled to arrive here sometime today. Now, how many people will be on that plane, we have not been told, or the time that plane is scheduled to arrive here as of yet. 34 people from Georgia who will be on that plane. Some good news for them. They will be allowed to quarantine at home. They are going to be allowed to leave the base. They are, we're told, going to be monitored by the state health department. So as you might imagine, after being quarantined on that ship for so long, that is indeed good news. As for the other passengers who are being brought here, we're told that they are going to remain on the base, that they are going to be housed in some lodging that is not being used at this point, that they will have no contact with the Dobbins personnel, and that the CDC is handling this quarantine operation. And it is important to note that none of the passengers that are being brought here, none of them tested positive for coronavirus. They're all asymptomatic at the point that they boarded that plane for the flight here. They are being quarantined here. We are told, just as a precaution, being held here for 14 days before they'll be released. Of course, if they do develop symptoms, we are told there is a plan in place and they will be transported to a local hospital.
Okay, Deidre Dukes with Fox 5 Atlanta there just outside of Georgia. Thank you for joining us for that live update. Back now to the West Coast and specifically San Francisco City Hall. We just heard a minute ago from Fox 2's Christian Captain. Here we see the head of the San Francisco Unified School District. He just announced that schools are staying open. Let's listen for more.
Having prolonged absences. In response to public health recommendations to limit social contact, events that bring large groups of students, adults, and community members together have been canceled, including student athletics. Within our buildings, custodial staff are cleaning common and high-touch areas multiple times a day, and we're providing resources, supplies, and time for students to wash their hands for 20 seconds with soap and water regularly. Please help us, parents, by keeping sick children home. If students exhibit illness or COVID-19-like symptoms, we will contact a parent or guardian to pick up that student immediately. We are exploring how to provide online distance learning in the event of a prolonged absence or school closure. We will not implement an online distance learning model unless our district can ensure that all students will have equal access to learning. We have a diverse student population, and some of our students do not have regular access to technology or the internet. We have procedures in place of a school or district closure, including providing lunches to students who qualify for free and reduced lunch. Our goal is to keep our doors open as long as possible, as the health and safety of our students and staff is foremost. And with that, I'd like to turn it over to the mayor of our great city, Mayor London Breed.
Thank you, Dr. Matthews. And along with Dr. Matthews, the superintendent of our school system here in San Francisco, and school board members, we're also joined today by the director of the Department of Public Health, Dr. Grant Colfax, as well as member of the Board of Supervisors, Aaron Peskin. We know that this has been a very challenging situation because we hear about various reports on a daily basis. And I want to just say, because I've been asked this time and time again, are we overreacting? And my answer to that is, here in San Francisco, we are doing everything to make sure that the facts, the data, the information based on the health experts of the Department of Public Health are taking front and center in how we communicate with the public and how we make decisions. We think that the misinformation that consistently gets put out there gets in the way of what is happening to do, what we need to do in order to address this real challenge. You know, I want to ask the residents, please don't panic. Please listen to the information we're provided, and please continue to work with us so that we can rise to the occasion and meet the challenges we know all exist in our city. This is about protecting public health. We are prepared to address this, and we want to make sure that the information we provide is being taken seriously and is being used appropriately. I appreciate the members of the school board as well as the school district and their decision to listen to public health experts and keep our schools open. We know that childcare could end up being a challenge for parents. We also know that sometimes this is the only place where many of our kids have access to meals and facilities and other places where they can even wash their hands. We have to think about, you know, the impacts on young people, and so I fully support that decision, along with the most recent decision that we made here in San Francisco to cancel all major events that exist in the city with over 1,000 attendees. We know that this is necessary because right now it's about mitigating the impacts. It's about making sure that we reduce and eliminate the spread. And we have followed in every single instance, in every decision that we've made, it has come based on the direction of our public health experts, which are some of the best in the world, right here in San Francisco, advising us as this virus progresses. And so I appreciate the work that the media has done to get the word out in order to make sure that accurate information is provided, that we're consistent in our messaging, that we are doing preventative strategies around making sure that we reduce or eliminate the spread. We know that this will have significant economic impacts, which we are also dealing with. But the most important thing at this time is public health. And at this time, I want to ask Dr. Grant Colfax to come forward and provide more information, more suggestions, the most recent information on what is happening now in San Francisco as it relates to the coronavirus. Dr. Colfax.
Thank you, Mayor Breed. Good afternoon. I am Dr. Grant Colfax, Director of Health. I am glad to be here today with the Mayor, Superintendent of Schools, and the School Board President, because we are united in our goal of keeping our community's children, families, and workers safe. In this rapidly evolving situation, we continue to learn more every day about the coronavirus and COVID-19. We know today that this virus has the greatest likelihood of harming elderly people and those with underlying health conditions and chronic illnesses. But in children, the illness has been very mild. They either remain asymptomatic or experience mild flu-like symptoms. In fact, in China, the epicenter of the outbreak, from what we know now, at this time, there have not been any fatalities in children between the ages of 0 and 9. This is helping us shape our thinking about schools and how to handle the question of closure. Schools are an essential service and crucial to our communities. That said, no one, neither staff nor students, should attend school if sick, and I cannot emphasize that enough. If you have a child with chronic health conditions, consult your healthcare provider about school attendance. And we know that schools are working hard to ensure everyone's safety, and we are partners at the health department in that effort. As much as possible, children should be able to continue with their education and normal activities, fortified by frequent hand washing. If there is a confirmed case of coronavirus, COVID-19, at a school, we will work with the school and the district to determine the best measures based on science and data with regard to potential school closure. We are still not certain that repeated closures are a useful intervention in the long term. Focusing on each individual case, you are going to pay less attention to the risk that is out there in the broader community, especially on the vulnerable populations I mentioned. And as we all know, the virus does not stop at the schoolhouse door. All of us have a role to play in decreasing the opportunities for the virus to spread. In San Francisco, we know the virus is here. Our goal going forward will be to attempt to decrease how rapidly the virus spreads among our community and doing everything we can to protect vulnerable populations. As we increase our access to testing, so will the number of confirmed cases. It is only a matter of time before multiple students and staff members at SFUSD schools have a diagnosis of coronavirus COVID-19. Given the current facts, coronavirus is in the community, so kids bring it back to school and vice versa. The evidence is mixed on whether closing all schools for a short period of time would make a significant difference. And this is what this is about, making a significant difference in slowing down the virus spread in our community. Especially in the Bay Area, where many people live their lives in more than one county, school closures is not convincing at this time as an effective intervention. And again, as the mayor and others have said, this is a rapidly changing and evolving situation. We follow CDC and state health department guidelines, and we consult regularly with regional health officers on this very topic every day. If our whole region chooses to coordinate around an approach that further restricts social contact, then closing schools could be part of a future, more comprehensive plan for slowing the spread of the virus. To be ready for that possibility, we recommend that all schools develop a plan for countywide school closures, and families should prepare for potential closures. We know that schools have many considerations of their own about what is right for their students and the communities they serve. We advise that any school that chooses to close to give families enough time to make arrangements for childcare during the closure and to try to avoid leaving children with older relatives who are more vulnerable to the impact of the virus. We encourage schools that close to use the time to plan, prepare and train staff about how to educate students on precautions and the facts of the coronavirus. An informed community is a safer community. SFUSD is doing a great job of following our guidelines and working with us for minimizing non-essential activities and ramping up health education, cleaning, and other key preventative measures. I am confident that by continuing to work together, we can respond effectively to this dynamic situation and unite to protect the health of all of our community. Thank you.
Listening in as we're getting the latest from San Francisco officials. Just heard from the Director of Public Health a minute ago. We heard from the San Francisco School Superintendent, Dr. Vincent Matthews, who said that school is still in session for San Francisco Unified. Some 54,000 students attend that school district alone every day. We heard the mayor, London Breed, say that she is making her decisions based on facts from the doctors. So some people are questioning it is a bit of an overreaction, as now large gatherings are banned in many countries, many counties across the Bay Area. We also heard a direct plea from the school superintendent speaking to parents, not just in San Francisco, saying, parents, please help us by keeping your sick children at home. So as we discuss more about how schools are being affected, we'll also focus on your health and your questions. This is one of my favorite parts of what we get to do every day, and this is why we join you live every day, to bring you the newest information and to get your questions answered. So let's bring back Dr. Patel, as we have a number of viewer questions I'd like to run through. The first one, Dr. Patel, is something that I've heard from before, and let's pop it up on the screen. The viewer question is, from what I've heard, more people have died from the flu this year than from the coronavirus. The viewer asks, why is the coronavirus so much more heard about in the news? Your answer.
Right. So those numbers are true. You have to look at what country you're looking at. But remember, the coronavirus is just entering the United States now. We've never seen this virus. We don't have any treatment for it, and we do not have a vaccine. In contrast, if we look at influenza, we still have influenza going on, and we have had cases and we have had deaths, as mentioned. But we do have therapeutics, and we have vaccines as well for influenza. And we have lots of people who haven't yet experienced coronavirus. That's exactly what public health departments are trying to prevent. The mortality rate, can be questioned because of how the data and the lack of available data on how many people actually have coronavirus. But looking at the figures that we have today, the mortality rate is pretty substantial from this coronavirus. Of course, the mortality of influenza is also high, and there are many deaths. But the concern is that there's no immunity in the population. There's no vaccine for this particular virus. And if it spreads, based on what it has done in other areas of the world, there will be many people affected, and there will be many deaths.
It is sort of the Wild West in that sense. Doctor, I have to tell you, I was at the health club yesterday, and I coughed because I got something in my throat, and then I felt bad for coughing, because I think now the lady next to me thinks I might be sick. Let's break it down to absolute basics. What are the symptoms of coronavirus?
Right. Symptoms of coronavirus. Well, first of all, many people don't have symptoms when they get this infection, but those who do get symptoms may develop rather mild symptoms, a cough, maybe a fever, that will be self-limited. It might take a week or two to recover from that. A smaller percentage, about 20% of those who have been diagnosed, and remember I just mentioned that we maybe haven't diagnosed all the cases, so these numbers may change, about 20% may develop more severe infections, with about 6% overall developing life-threatening infections, respiratory failure, septic shock, organ failure, really sick and potentially going on, not in that high a number, but potentially going on to death. So it's really a spectrum, right, that goes from no symptoms at all to some mild respiratory symptoms to severe respiratory symptoms and basically pneumonia. So this virus, if you think about it, starts in your upper respiratory tract and then in some cases can go down into your lungs and cause pneumonia.
Okay, let's talk about those who are most vulnerable. I know that you've helped guide us in really understanding that those who are elderly, those who have underlying health conditions are most at risk. Our next viewer question is on this very note. The viewer writes, they say hypertension is considered a concerning underlying condition. Are we seeing young people with hypertension in serious jeopardy?
That's a really good question. I would say it's probably coming from someone who either has hypertension or knows someone who has hypertension and is younger. I would say, work on getting the blood pressure under control. When we look at risk factors, it's really epidemiology. Now I'm going to talk a lot of science, right? And there's an association there. It doesn't mean that everybody with hypertension is going to get this infection and have a bad outcome. But I would say, think about it in terms of, yes, it is a risk factor. So you heard from some of the other folks who have been talking to you this afternoon about what you can do if you're at risk for this virus or complications of this virus, but also work on getting the hypertension under control. Another thing to think about in this day and age is, do you have enough blood pressure medications on hand if you need to stay at home for some period of time, or should you get your prescriptions renewed now so you have enough on hand? I don't want people to stockpile for months, but enough for the next couple, 3 weeks, something like that would be reasonable. So refill your prescriptions if that's necessary, your blood pressure medications, that is.
Okay, next up, doctor, I know we're living in an increasingly cashless society. I know some organizations have recommended not using cash during the coronavirus pandemic. So our next viewer question is on that topic. Viewer asks, can you catch COVID-19 from touching money?
Well, theoretically, I suppose that's possible, but I'm going to tell you something you can do to protect yourself, right? So if hypothetically, someone who was infected with this virus and shedding the virus in their respiratory secretions, say coughed on their hand, not on a tissue, right? So now the virus is on their hand, and then they pull out a dollar bill or $5 bill or something like that, and then hand it off to you. Now you touch it. Yes, potentially it could be on your hands, but it's on your hands. You don't get this virus through your hands. You then have to take the virus and you have to inoculate it into your mouth or your nose or your eyes. So most importantly, wash your hands with soap and water. And maybe we should say wash your hands with soap and water after handling money that's been recently touched by somebody else. The money that's sitting around maybe at home that's been there a long time. I'm not going to worry about that. I agree we're an increasingly cashless society, but I suspect there are situations where people need to use cash. Main message, wash your hands.
Okay, next question comes from a viewer in Northern California. Aaron writes, can a person just be a carrier of the virus?
Yes, and that is another really good question. So people can pick up this virus and have no symptoms. We call that asymptomatic. And so they pick it up, they get infected, but they don't have any fever, any cough, any runny nose, nothing. They may subsequently develop symptoms because there is what we call an incubation period, the time from acquiring the virus to developing symptoms, or they may never have symptoms. And, that's part of the concern about this virus is you can have people who are minimally sick or people who are not sick who are carrying the virus for a period of time. So this is a really good question and something to think about. Again, though, it's going to be spread in the same way. by respiratory droplets. So if that person coughs, presumably they're not going to cough unless they're like you. Maybe you coughed for another reason yesterday.
Yes.
They cough and now the droplets come out. But droplets also come out when people exhale, breathe out. So that's normal. We all breathe out. And so if you're really close to that person, within, say, 3 to 6 feet of them, you could potentially be exposed to the virus that way. And of course, their droplets, as previously described, go out onto surfaces around them. And so then if you touch those surfaces with your hand and then don't wash your hands, but then put your hand in your mouth, nose, eyes, then you can self-inoculate with that virus. So very good question. Yes, that's possible.
Okay, I would like to, and if I can ask the director to skip ahead by one, I hate to, Anna, but please, if we could skip to the 7th question here, this is an important one. Our viewer writes in and asks, how long does it take from contact with an infected person until the time you might start getting symptoms? That comes from Phoenix.
Right. So that's another really good question. So there's a range, first of all, as you might expect, that can go from 1 to 14 days. Usually it's going to be around 5 to 6 days, but again, it's a range, right? Picture sort of a bell curve, if you will. There are cases where it takes longer than 14 days, but most cases would be between that 1 and 14 days. And again, typically 5 to 6 days.
Okay, Dr. Robin Patel, this all goes back to what you and others have been saying from the very, very beginning. Wash your hands, don't touch your face, and don't panic. Thank you again for sharing all of your time and expertise. I know we'll draw on you again, as certainly this issue is far from over, Dr. Robin Patel. That's going to do it right now for this broadcast, but we're not going away in any way, because we're going to be streaming live for you every day, as we have been, starting at 1 o'clock Eastern, 10 a.m. Pacific, bringing you the latest information as it relates to the coronavirus pandemic now. We are able now to take you to a number of live events as they unfold around the country to get you the latest information and perspective on what's happening in your community. You can go to coronavirusnow.com for news in your area. That's up 24/7. At the top of the hour, there's more coverage. In the meantime, we're going to leave you now with the Homeland Security hearing on the federal response to the coronavirus. The coronavirus task force, of course, headed up by Vice President Mike Pence. This is unfolding now in Washington, D.C. I'll give you the quick headlines here before we go to Washington. The WHO is now referring to the coronavirus outbreak as a pandemic. That language, if you will, that designation came out just about 2 hours ago. A quick check of markets before I have to leave you shows that we are still very steeply in the red when it comes to the Dow, the NASDAQ, and the S&P. At this point, the Dow is down by 1,300 plus points, losing 5 1/3%. The S&P is down by 4 3/4%. NASDAQ is down by 4.5%. This is all about uncertainty, which is the least favorite thing among investors, so markets are sharply in the red. That small pop we saw yesterday has been erased, and much more. We also heard from the mayor of San Francisco saying that she is announcing all large gatherings of 1,000 people or more are no longer to happen in her city. The situation is the same about 50 miles to the south in San Jose. We also took you in the recent minutes to an area just outside of Georgia, where some passengers who were on board the Grand Princess cruise ship docked at the port of Oakland are now arriving in Georgia for a 14-day quarantine there. Again, the situation is unfolding minute by minute. We're able to bring you the newest information thanks to your joining us live, and the coverage continues on your local Fox Television News station's website. That's 24/7. And again,